Understanding Bulimia nervosa. This module takes a look at bulimia nervosa, commonly referred to simply as bulimia. We'll be learning about the key symptoms of bulimia to help you understand this serious mental health condition. The key things we'll be discussing about bulimia are that it's characterised by a binge-purge cycle, that it's hard to spot, that it can sometimes lead to fluctuation in weight, and that sufferers tend to evaluate themselves based on their weight. The key characteristic of bulimia is the binge-purge cycle. A typical pattern is for a sufferer to consume a large quantity of food in a very short period of time. This is called binging. The type of food varies from person to person, but it's frequently very unhealthy convenience food such as chocolates, cakes and fast food. After a binge, people with bulimia will try to remove the calories from their bodies. This is called purging. Purging can take many different forms. Most frequently, sufferers will make themselves vomit, or will abuse laxatives or diuretics, or compulsively exercise. Most bulimics will try to control their weight using dieting, but they tend to be very emotional eaters, and if a stressful situation arises, food will often be sought for comfort, as this may be the only way in which they're able to make themselves feel better, or to numb their emotional pain. Alternatively, a small slip-up on their diet may trigger a huge binge. The binging episode will in turn trigger a purge, as the sufferer feels guilty about the large quantity of food they've just eaten and tries to rid themselves of the excess calories they've consumed by vomiting or taking laxatives, or maybe using an alternative method of calorie purging. After purging, sufferers often experience extreme feelings of shame and self-loathing and guilt. This will strengthen their resolve to diet, as they often believe that if only they could stick to a sensible weight loss diet and lose a little weight, that they'd be happier and more respected by other people too, and so the cycle starts again. Once trapped in the diet, binge, purge cycle of bulimia, it can be very difficult for sufferers to escape, and almost impossible without professional help. Bulimia can be really hard to spot, and often goes undetected, as sufferers tend to maintain a roughly normal weight, as they work hard during a purge to expel all the calories they've consumed during a binge. In addition to this, sufferers are usually very secretive about their bulimic behaviours, of which they're likely to feel ashamed or embarrassed, which makes the illness even more difficult to spot. However, whilst most people with bulimia tend to have a roughly normal weight, only about 50% of calories can ever be expelled by purging. So one characteristic of some bulimics is a fluctuation in weight, as they may gain weight during difficult periods when they're binging and purging heavily, and lose some weight when they're binging and purging a little less. People with bulimia evaluate themselves based on their weight. They tend to suffer from really low self-esteem and attach a disproportionate importance to their shape and their weight. They usually consider themselves too fat, regardless of how fat or thin they are, and they use purging in order to try and control their weight. They also think that everyone else is constantly judging them according to their weight, which is one of the reasons they're so motivated to try to control it. Okay, so it's time to recap. The things we've discussed about bulimia are that it's characterised by a binge-purge cycle, that it's hard to spot, that it can sometimes lead to a fluctuation in weight, and that sufferers tend to evaluate themselves based on weight. We hope you found this module helpful. You may like to watch similar modules to help you understand anorexia or binge eating disorder. For more eating disorder support and advice, go to www.eatingdisordersadvice.co.uk.